Hello everyone, this is Dr. Soumya Guha, Senior Consultant Cardiothoracic Surgeon at BM Birla Heart Research Center, Kolkata. And today we will discuss a few myths surrounding robotic surgery. So robotic surgery is the most latest advancement in the field of heart surgeries, where we use the help of robotic arms to deliver to you very precise surgical care with very little tissue trauma and very little pain to the patient. So people often ask me, dear doctor, will a robot do my operation? So I tell them no. This is a master slave concept, which means that the operation will be done by me, a surgeon, and we will be operating on a console, and our exact hand movements will be translated by the robotic arms within the patient. As you can see, our hands are big. For our hands to go in, the cuts have to be really big. But imagine if these hands could become as small as 8 millimeters and they go inside the chest, how precise our movements can be. And that is exactly what a robot does. So our movements are translated into the movements of 8 millimeter instruments inside the chest, which is how with these small cuts we are able to do those surgeries where initially long cuts, bone splitting cuts in the chest were required. Second question, is robotic surgery safe? Well, we do not offer a service to you that has not been tried, that has not been researched, and that is not safe. At the end of the day, our purpose is to help you become better, not to experiment. And unless we can get you to a socio-economic productive life, we are not really helping you. And because we saw that normal sternotomy and conventional surgeries had longer recovery time, people had to stay away from work, had to deal with a lot of pain, which is why we constantly upgraded and we landed up with this current advancement of robotic assisted heart surgery, where cuts are very small, there is almost no pain, people are going back home and getting back to work within a week of surgery. So that is where we are headed, and that is what is right now happening in my unit at BM Birla. Robotic surgery is safe, but patient selection is very important. We cannot offer this to everybody. There are strict criteria we follow, and this is only for your safety. So only those patients who fit the criteria, we offer them the robotic assisted heart surgery. Third question people ask is, AI is there, so can somebody manipulate the robot? Well, let's be very honest. AI is used only for analysis. It is used so that we can upgrade our skills. But when we operate using the robot, only we can operate the robot. There is no way an external influence can come in and operate the robot. There is no way the robot can think for itself. The robot does not have a mind. It is our movements that are exactly translated in robotic arm movements, which is why only what a surgeon does at the console, a robotic arm will do in the patient, which is why it is quite safe. This is not some android or cyborg operating. It is your surgeon operating with the help of robotic arms on you so that you can have a painless, precise surgery. Thank you.